Epilepsy is a very important public health problem simply because it's very serious. So that's the first point, and also because it's very common. Like in Kenya, we know that 20 in every 1,000 people usually experience epilepsy. And it's important that it is distinguished from other seizure disorders, because you can have seizures with fever in children, and you can also have people experiencing just a single unprovoked seizure, and until when they have like 2 unprovoked seizures 24 hours apart, that's when they can say to have epilepsy. So outside of epilepsy, there are usually so many other problems that are associated with it. So ranging from medical comorbidities, and that can be anything that you can think of, from hypertension, from diabetes, and so many other comorbidities. And it's been found that the risk is usually elevated in those with epilepsy than in those without. And so is the risk for psychiatric comorbidity, specifically mental health problems, for which we've been able to conduct some studies here in Kilifi in both children and in adults, and indeed found that the risk is usually elevated in those with epilepsy than in those without epilepsy. And therefore, this brings about the need to develop very comprehensive interventions for addressing all those problems together. So when you are managing the seizure disorders, then you also need to involve other people like psychotherapists, including even the psychiatric nurses and the psychiatrists, so that you can also be able to address the psychiatric comorbidities of these people. So when you have all those comorbidities together, you can therefore see then that the quality of life of these people is going to be significantly affected. And whenever they start having mental health problems, and they also have intellectual disability, again, their adherence and compliance to anti-seizure medication is usually compromised. So that increases the treatment gap for epilepsy, and when the treatment gap goes high, then subsequently it can increase the risk for premature mortality, for which here in Kilifi we found that the risk for dying earlier is usually 6 times greater than in those without epilepsy. And we can actually use that point to try to motivate people living with epilepsy to adhere to the prescribed treatments. So when you get treated for epilepsy, in Africa, we have a little bit of challenges because we don't have access to the new generation anti-seizure medication, but we rely mostly on the older anti-seizure medications. For example, phenobarbital, phenytoin, sodium valproate, and carbamazepine. And therefore, even if it has been hypothesized that with appropriate treatment, 70% can have a complete seizure control, in Africa we've not been able to estimate that because of the fact that we don't have quite a lot of drugs at our disposal. However, at the moment, we will still encourage the patients to adhere to what we have, and to hope that we are going to sort of like get the government to increase the armamentarium for the management of epilepsy by making the other newer generation anti-seizure medications available in the primary health care centers, so that each and every person with epilepsy can be able to access them. So there is quite a lot of awareness that is needed, not only awareness to reduce the stigma in the community, and not only awareness and education among people living with epilepsy so that they can adhere to treatment, but also awareness with the epilepsy stakeholders, including the government, so that they can increase the budget allocations for this condition and train more experts. And that's the only way we are going to succeed in ensuring that the diagnostic and the treatment gap for epilepsy in Kenya is addressed.